This morning, and let's say good morning to Dr. Stan Odle from the Health Risk Clinic. How are you doing?
Fantastic, Doug. Good morning, Kim. Good morning, Barbados. Great to be here. Thank you.
As usual, you normally come when there's a clinic going on, or a public clinic, and there's new product to talk about. What are the products you're going to be talking about this morning, and when are the clinics?
Okay. The principal reason for my being here this morning is to bring to the public's attention a free health seminar we're putting on this Saturday. And it's going to be, there are two different times, give folks an opportunity to come out, 4 p.m. and 7 p.m. It's totally free. The venue is the Southern Palms Hotel Conference Room. And really, because of my science background, we're going to be focusing on what I consider to be the science-based, my topic, the topic for the convention, for the seminar is science-based medical solutions for the treatment of chronic non-communicable diseases. We all know that those CDCs are on the rise, and there are strategies that medical practitioners, alternative practitioners, and so on, healthcare practitioners need to understand and bring to the notice of the general public. And we're going to be focusing on three areas. The iodization, in other words, including iodine into your diet, into the human system. The improvement, or shall I say, a better word would be the enhancement of the human immune system, and of course a very powerful medical modality that's been used right across Europe. It's used in Russia, it's used in Germany, is also used in Cuba, and there are entire hospitals in India set up for this. It's called medical ozone therapy, which is very different from a procedure, a practice that we had here in this country and still may have, which is sitting in a steam tube with your head out and having ozone passed over your body. So we're going to go through those three areas of concern almost in that order. And with the immune system, I'd like to bring in a friend and colleague when we get to that juncture from the United Kingdom, a specialist in formulating powerful immune system products. And we're focusing particularly at this period of time with the recent coronavirus, which is a SARS type virus.
Well, Dr. Stan, the average Bajan has been educated to some extent on ozone therapy, and as you mentioned, everyone knows the box you go in, your head stays out. But explain for us the concept of RHP, recirculatory hemoperfusion. Okay. It seems to be one and the same, but it's more clinical.
It's very, very, very different. And I don't know if the camera guys can get a picture of this here. This is it. This is a device that delivers iodine, that delivers ozone into the body.
So this is a completely different system.
This is a completely different practice. This is high science. This is high medicine. In fact, you're going now to the third point of the presentation, so rather than the first. So let me, if you don't mind, and I've written something here, and I don't want to paraphrase this. It's important that I get this out to the public. So here it is. What is medical ozone? Ozone therapy is one of the most powerful and versatile therapies known today. Extensive medical research on ozone therapy has been done primarily in Europe. Through its mechanism of action, and to a scientist that's always important, we want to know how precisely does this function within human physiology. Has been used to treat infections, wounds, multiple diseases, and of course to disinfect drinking water. Medical ozone therapy is effective as an anti-cancer, antiviral, antibacterial, antifungal agent, and for that ozone is unsurpassed, mainly because there are no appreciable side effects. Some of the benefits would include the inactivation of bacteria, viruses, and fungi, the enhancement of circulation, so for cardiovascular challenges, there's nothing like this. Nothing out there can touch this, unless you decide to have bypass surgery, by the way. Dissolution of malignant tumors, activation of the immune system. Now you may ask, why ozone therapy? Well, because scientific studies have proven that ozone properly introduced in the body in repeated applications inactivates viruses, bacteria, fungi, protozoa, and carcinomas in disease cells. How does it work? And this is part of the mechanism, and it's important that folks hear this again. The therapy has been used in Germany for many years by thousands of West German doctors who claim in hundreds of scientific and clinical studies that they were able to inactivate even AIDS cells. There's a doctor, Horst Fess, out of Germany, did extensive research on full-blown HIV/AIDS patients, and with this modality was able to turn it around. I'm just thinking, here in this country, we're burdening this government and any government that comes to the table with the extremely high costs of the drugs to treat the AIDS situation here, and other scenarios.
Well, is this treatment available in Barbados now?
It is, absolutely. Health Heroes Clinic.
And what has been the response from the public at large and the medical fraternity generally?
Right. We've exposed this to a couple of medical practitioners here, and they're very, very pleased. By the way, this is something that can be and ought to be used in conjunction with traditional, mainstream allopathic medicine. This is not some bit of alternative modality that's out there.
We have on the line Peter Josling from the UK. He's here to share with us, as you mentioned earlier. Absolutely. Good morning, Peter Josling.
Good morning to you all. How are you all doing today?
Doing marvelous.
Doing well.
Tell us a little bit about the cellular enhancement of the human immune system.
Well, most people don't really understand that there are two different types of immune system that we all have. We have an innate immune system, and we also have an adaptive immune system. And the adaptive immune system is what helps us to repel boarders once they've tried to infect us at some stage in our lives. But the innate immune system is there all the time, and it doesn't have a memory. So what researchers strive to do is to find compounds and agents that can basically stimulate both the innate and the adaptive immune system. And the reason for that is, as we all know, over the last 10-20 years or so, the number of pathogens traveling around the world, mostly from China, across Europe, into America, and then obviously into the West Indies, some of them are really, really very nasty, and it's very important to have a fully functional immune system that is capable of repelling these nasty pathogens. So,
are you saying to us that this science-based medical solution for the treatment of non-communicable diseases can span the gamut of from cancer to the common cold?
Oh, well, very much so. I mean, certainly the agents I work with specifically stabilized allicin, which is it's been around. I actually led the team that invented this material, and that was about 10 years ago now. This stuff is sold in about 20 countries around the world, and it is unique in that it can kill viruses, funguses, bacteria, intestinal parasites. And what we've learnt over the last few years is that it actually helps to boost both the innate and the adaptive immune system, particularly by increasing the number of CD4 T cells, the killer cells that your immune system obviously needs to be able to protect you against picking up an infection wherever that may be from. And the other thing that's happened in the last 10 years or so is that the amount of infections that can be contracted has increased substantially, and the areas where these organisms can be contacted has increased dramatically too. So it's very, very important to have an agent that can not only treat infection but also can protect your own immune system, because obviously we don't know whether it's going to be the new H7N9 coronavirus, which is spreading across China and the Middle East, and now it's in Western Europe. It will soon reach the West Indies and the continental United States.